Well, I'm back in Sydney now. As you can see, I'm in the International Conference Centre. You should really come and see this. It's fantastic. It's like got everything and it's huge. But would you believe it? Can you believe who I bumped into? I tell you what, I'll give you three guesses.
It's the one.
It's the one and only. I'll give you three guesses and you'll know. It's the fabulous Tim Kelsey. Here he is. Look, here he is.
Hi, Roy.
Hi, Roy. And he looks so tanned and young and lovely.
Sydney.
He's like the boy from Ipanema. What are you doing now? Listen, tell us what you're doing. You're like 90 seconds to tell us what's happened since I saw you last.
So, great privilege. I now run what's called the Australian Digital Health Agency, the agency in Australia responsible for bringing all the benefits of digital health to citizens in this country, and we've had some great success. So in fact, by the end of this year, every Australian will have a mobile health record, unless they choose not to have one.
Wow.
Building on all the lessons, frankly, I learned in the UK.
And there were
lots of good, great, and
it was a great platform.
A great platform, and lots of good things happening around the world. But
so let's be clear, every Australian citizen who wants one will have a digital health record.
Correct. By the end of this year.
And they can access their own health record?
You're correct.
And they can give permission to
others
to access the health record.
It's their record.
Yeah.
So the legislation is very clear. And this is sort of an important...
That's the big difference then, because in the UK, the health record belongs to the Secretary of State.
Well, arguably. So in actually the UK, the legislation is that the data in a health record is the person's, but that's not yet been delivered in the sort of practical reality of the experience. In Australia, the legislation is very clear. My health record is my record. I can decide who sees it. My pathology, radiology, dispense prescription information is in it. And if I choose not to share it with my clinician, that's my choice. So I think it's an incredible program, very strongly supported here by the clinical leadership, the Medical Association, the Royal College of General Practitioners, etc. Because all the use cases, emergency healthcare, chronic disease management, etc., will massively improve through shared information. It's very obvious to say that. And Australia has rather like England, has an ongoing issue with things like adverse drug events. So in this country, I'm not sure what the figures are in England at the moment, more people die from adverse drug events than they do from road traffic accidents. And that's largely to do with paper-based healthcare, the fax machine whirring on in the background. Like, how can we deliver digital, secure, intelligent sharing of information to support clinicians, their patients? And that's the job that I have. And the amazing thing is that by the end of this year, every Australian will have a kind of like an online bank account for their healthcare.
And isn't that fantastic, Tim? I'm so pleased I bumped into you. I wish you well. And
good to see you.
I can't wait to come back, actually. It's great to see you.
Good to see you.
Goodbye for now. Thanks.